Good evening, everyone, and welcome to yet another session of Sphere India COVID 19 Academy. The COVID 19 Academy is a joint collaboration of UNICEF India, WHO India, HCL Foundation, and Sphere India, aimed towards the capacity building of volunteers and frontline workers for COVID 19 preparedness and response. Today, we are having a panel discussion on experience sharing and learning from states' responses to COVID 19. So, states across India have been responding to the COVID 19 This panel discussion will focus on the learnings and experiences of different states and the strategies implemented by them at the state level to respond to the COVID 19 pandemic. The panel discussion brings in senior level government functionaries from 3 states across India for this. Today, with us, we have for this panel discussion Professor Sharma. Professor Sharma is the Honorary Vice Chairman, Sikkim State Disaster Management Authority, and senior faculty at IIPA, and responsible for making state policy and plans, district, block, and village level plans for disaster management, and their uh, implementation at different levels. Next, we have with us Mr. Munish Kaushik, who has 20 years of experience working in development sector, especially in the field of disaster management and child rights. May I please request the panelists to keep their mic muted for just a few seconds, please? Thank you. Right. So Mr. Munish has 20 years of experience of working in development sector, especially in the field of disaster management and child rights. He headed an international organization, Cod Aid in India, and used to work for Cod Aid in India, Bangladesh, Philippines, and Indonesia. For the last 5 years, he has been an active member of the Education Task Force and implementing education reform in the team of Education Minister. He's also the member of the COVID-19 response panel formed by the Honorable Chief Minister of Delhi. We also have with us Dr. Shekhar L. Kuriakose, who joined the government of Kerala in 2011 and is serving the Kerala State Disaster Management Authority, the state level statutory apex body for disaster management since then. He serves in various high-level government committees, represents the government of Kerala and the executive committee of the Institute of Climate Change Studies, and several national committees on disaster management. Dr. Shekhar is currently stuck a little at the Secretariat, and he will be joining us in just a few minutes. Lastly, I would like to introduce our moderator, Mr. Vikrant Mahajan. He has 24 years of professional experience working at interagency policy level and frontline humanitarian action with government, UN, corporations, CSOs, and armed forces in diverse contexts. He has led interagency coordination for more than 100 disasters and represents on governance and policy level committees of several international organizations. He currently works as the CEO of Sphere India. I welcome each and every one of you. I am Valerie. I will be your host for today, and Vikrant will be your moderator for today. Over to you, Vikrant, to take forward the proceedings of this panel discussion. Thank you very much.
Yes, thank you so much, Valerie. I think today we have a very interesting panel. Dr. Shekhar Kuriakose, he stuck up in some government meeting. Suddenly, a meeting has been called by secretary. He's there. He said he will join soon. I think while he joined, we will start our discussion, and we have few states with an extreme of experiences. Actually, to say, while we are state of Delhi. Mr. Munish, I think Delhi represents a very different state here, and being the national hub, also the national hub of the movement in the of all the travel in the region, high density of population there. So Delhi, one very different extreme case, and a very large number of cases we see vis-a-vis compared to other states. And also Delhi is a hub from where we have seen a lot of returning back of the migrant workers. The issues and challenges of migrant workers was big there. Then we have experience there in the other state on the other extreme was Sikkim, which was totally till Last few days, there was not even a single case. As on date, we only have 7 cases reported over there. It's not just because of the sparsely populated state with the low density of population, but we still have the urban centers, but it's some very very specific strategies which have been led to control of the COVID spread over there. I think we will get to hear from nobody else but Professor V.K. Sharma about that, who is Honorable Vice Chairman of the state. Then Kerala, in other contexts, represents not only I think a global case study in how the entire management of the COVID experiences has been there. Some very good learning to come from the state of Kerala, from all the 3 states together, perhaps. And since we are still in this situation where from the lockdown going to the unlockdown, I think this is a very critical and crucial time when I think hearing this from each different states and working on the future strategies ahead will be very helpful, I hope. And rightly with us with a very diverse set of participants also coming from directly from the field on the front end of COVID response. I think we take it up in a more of volley of questions, and I straight away go to our panelists now. Maybe firstly, maybe I'll just put the question to Munish. I I've been working closely with Munish, during daily violence also, where there were early signs of the COVID discussions were happening, and then even now on a frequent basis, exchanging information and supporting the migrant other thing. So Munish, hearing from you, what have been the challenges of working in daily in this COVID context, and very focusing specifically on the COVID response? What has worked well and what could have been done differently? Over to you, Manish.
Thank you, Vikrant. Thank you so much. It's audible. I'm just checking.
Yes, you are audible, sir.
Great. Yeah, actually, you already set the background because Delhi being the capital, as you know, and it's the place for everybody. It's not just for the Delhiites. It's quite a challenging situation and quite varied from different states. That is one. Second, the type of situation or the disaster we are seeing now is unprecedented. Actually, we have never seen this in Indian history, at least in our memories. So, as you already mentioned in your introductory uh, submission, basically this COVID response having 2 dimensions. One is the medical one, which we all know, but second is also the social one, because situation is not normal. The whole nation has gone almost in a lockdown and curfew situation, and then from the medical situation, it all led to the food crisis or the migrant crisis. So that is also governments are handling simultaneously. So we can talk on the both aspects. I think before the whole medical thing started, first we started responding as a state on the social issue, that the moment, because lockdown was announced on 4-hour notice, and at 8 p.m. it was announced, and by 12 o'clock the borders were sealed, and it was all panic everywhere. So the biggest challenge for the government was to ensure to the public that you need not to panic, and staying inside is the best strategy. And when you are staying inside, then there are several questions that what will happen to the basic needs, essential services, and medical mobility. So these were the all questions which were in the mind of public. So what we, and second challenge which is in Delhi is that like 70% or 75% of Delhi is unorganized sector. It's not that everybody's data is with the government, because many people actually migrate from neighboring states, especially Bihar, Jharkhand, Chhattisgarh, Uttar Pradesh, Eastern UP. These are the places where people come and work as a laborer in different unorganized sector. So it's not easy actually to track the whole population. So first intervention, what we did, ensuring the food security. That I'm saying even before the medical thing started happening. So one concept we started, which called the HRCs, is called hunger relief centers, where we opened almost 2,800 hunger relief centers across state, and we opened our Directorate of Education schools, where every day around 1,000 people, uh, uh, each time were served free cooked meal. That was the first immediate step we took on 22nd of March. That was the beginning. And the second thing was we immediately did, as government was, free distribution of ration for 3 months. A, for the ration card holders. B, also for those who are not ration card holders but can apply immediate and instant ration card by applying on mobile through an app or through the website. That was the second. And third, even if those people who are not having those facilities, especially mobile and all, they can avail the coupon, physical coupon from the local MLA or the member of parliament, and can go to any of the schools which are the ration centers and can get the ration. So that was the first social issue we started handling, that nobody should go hungry. That was our motto in Delhi. That was one. And earlier, our estimation was that there are around 20 lakh ration card holders, and we thought another 10 lakh will be, which will be the additional people who are not ration card holder but will apply electronically. But to our surprise, within 3 days, around more than 25 lakh people applied. So it was a huge challenge for the government, that we were not having any database. Then within 3 days, more than 25 lakh people applied, and our estimate was 10 lakh. And in last 2 months, we ended up providing ration to more than 55 lakh people. So at one place we are estimating 10 lakh people, but now ended up giving ration to 55 lakh people. Was a huge challenge, but that we could achieve successfully. There were some issues, but we could reach out to the people through our different ration centers and hunger relief centers. So Vikrant, that is the social side. But second, on the medical side, because many people, especially also in education and health revolution, last 4 days, 4 years, 5 years of governance, many people has a lot of hope from the Delhi health systems. So one of the challenge was basically we faces from the neighboring states, UP, Haryana, districts like Ghaziabad, Noida, Greater Noida, Faridabad, Sonipat, which share borders with Delhi. That the moment there are COVID cases, they immediately rush to Delhi. They don't, I don't know, but they don't trust their state systems. So first and foremost, for us important was to ensure sufficient number of beds. So the first thing which health ministry did, we dedicated some of our hospitals, which we call them COVID hospitals. So they become 100% COVID, like LNJP is 100% COVID. Rajiv Gandhi Specialty Hospital is 100% COVID. So there are 2,000 bed in LNJP, 500 bed in this Rajiv Gandhi in Shadra. Then you can go to GTB, then Max. So we have around more than around 6,500 bed available for COVID patients. And still, yeah, I think we were checking data in today afternoon. There is an app also where you can track how many beds are vacant. So still we can accommodate additional 2,300 more people. There are beds which are still vacant. So there is no dearth of beds. So that was on the medical side. Simultaneously, we are also opening lot of our we call them our flu centers and COVID care centers, where people can just go and have their quick corona test. That is the second one. I won't take much time, but third one, which is more important for us, see, prevention and cure. Sorry, prevention is the best way to handle this corona, and how people can stay safe when they are not mobile. Second, like many medical specialists said, it is one of the types of viral fever. It's like, but the only thing is it's more contagious than routine viral. So we are also promoting that people should go for self quarantine, home quarantine facility, because in 80 or 90% cases you don't need a medical treatment, serious medical treatment. Only for the aged people or those who are having different ailments go for ventilator or oxygen. So we are also engaging with one this civil society organization called Portia, which also help us in facilitating home quarantine. And once we give them identify and give them the infected person, they do daily or like thrice monitoring of that person. So apart from indoor health medical facilities, we are also simultaneously promoting home quarantine facilities. either in hotels or at respective, homes of those infected people. That is on the medical side. So far, Vikrant, I just shared with you what exactly we are doing. But I think next, in another few minutes, maybe you may like to ask other people also going to share the challenge as well.
Yeah, Manish, maybe going with this, I think you shared about the challenges and responsibilities.
Okay.
But maybe I can
Okay.
quickly come back to you about one quick question on your sharing itself, Manish.
Yeah.
You said that the planning was for 10 lakhs and it turned out to be 50 lakh, 55 lakhs,
Yeah.
right? Uh, is it somewhere as a system, as a government, we couldn't anticipate these numbers before? I
Yeah.
think, and it's not only in Delhi, it's happened, seems to like, and it's not just government. I think everybody, all of us, perhaps, I think we just, don't you think we miserably failed in anticipating the extent to the informal sector will be engaged here in our cities
Oh,
about this?
absolutely, absolutely. I do agree with you, Vikrant. See, we had some data of informal sector earlier, and we had one drive during our previous government that let's digitize those people who are the migrant workers or whoever in the informal sector. This exercise won't take much time. This exercise actually failed because we had some incentive. Like if you register yourself, you get 50 rupees or something. And if somebody else like Vikrant helps in enrolling 20 rickshawalas in this, so Vikrant will also get 50 rupees per person for the enrollment. So you will get for 10 people 2,000 rupees or 5,000 rupees. But what started happening actually, suppose you are a middle class person, because now it was incentivized schemes, people started enrolling everybody. So even if I am not an informal sector, but just because it was incentivized, everybody starting enrolling. So that exercise actually failed at that time when we started. So you are absolutely right that we had some data that these so many people are in informal sector, but actually imagining the magnitude of that problem, I will say yes, it was a challenge. It was a huge challenge, and I think this challenge continues because we still, I think this is COVID is a lesson actually, because one of the tasks which lies ahead with us is actually how to streamline and how to make sure that how many people are actually residing in Delhi. Not just in terms of migrant workers, so many colonies actually not regularized. So it's actually a Herculean task to actually assess the magnitude or the number of people who are informal or in informal sector and in what situation they are living in. So I do agree with you.
Right. Thanks, Manish. I understand also that your government's been, in all your planning and in all your, your government has been closely working with these people. Maybe I'll come back to you about that later. I think
Right.
it's something now is to hear from Professor VK Sharma. I mean, it's not just Sikkim. I think we know him also as one of the most senior most person for disaster management in India. So, sir, maybe firstly from the perspective of Sikkim, I think in the entire map of India, what we have been seeing as the surge in the number of cases was coming in. I think Sikkim was completely sitting separately as a one bright spot. I think is and it's again while one can reason it out, it's about the way the population density and other things about the state, and the state is a bit remote, not much travel movement with the rest of the country. But there are some excellent, I think, strategies adopted by the state government over here. So we would like to hear from you. What is it that was there the entire planning, and what has worked well, and what has been your experience with primarily with Sikkim first? Sir. Over to you, Professor Sharma.
Thank you, Vikrant. And I, first of all, compliment you, for starting this educative process and COVID Academy, series of webinars and on different subjects. And I think this experience sharing, I really appreciate that you have selected states which are altogether different, capital, Kerala, which is very high population density, and on other side, Sikkim, which is totally environment friendly, less population, only 600,000 people, very small state, 4 districts, And thanks to you that Sphere India, helped us in making district plans, state plans, and very, very effective plans, I should say. In fact, in this COVID, as you all know, that this is one disaster that nobody was knowing, what we should do and where we should go, where to start. Actually, this was the issue. And I was in Sikkim, basically. We had a meeting with the Honorable Chief Minister on 5th of March. And we decided that in this situation, basically, the best thing is that we should follow whatever is the central government guidelines or initiatives and do that. But at the same time, we realized that because most of the infection is coming from the foreigners. So on 5th March itself, we banned the entry of any foreign tourist. And that was the first step, which was very good. And there were some permits, with people, but still we requested them that now from 5th onward, we cannot take any foreigners. And later on, from any tourist from India, from the country also. So these two things were very, very good. And this saved us for a long time. In fact, as you rightly said, that there was no case of corona in the state because we didn't allow, any person to come in. But when these, migrant laborers and all these, things happen, then Sikkim government also decided that we should also take back our, people from Sikkim who are working outside or who are students. Thank God that we don't have many laborers, working in different other part of the country. But very important thing, and again, I thank you because in district plan, we have one very important aspect, the database. And we were having a very foolproof database for all 4 districts. And we can count that we have 10,445 people outside the state who are either studying there or working in some capacity or doing some business. So I think this database is very important and we were having it. And then we decide that let us bring them very systematically. And not only this, at 2 entry points, whatever vehicles were coming, we were sanitizing the vehicles. And we didn't take any chance that this virus should enter, in this state. But few days back, when these people start coming, up to Friday, I think more than 5,000 people returned back to Sikkim. And Friday, the score was 3. 3 people we find infected. But today, there are 4 more cases which are positive. And 2 are not yet confirmed. But yes, 7, you rightly said that 7 cases are reported. And all these 7 people are neither laborer or something, they are students who are studying in Rajasthan or in Kerala or in other states. And when they came back, we had thorough for each and every one. Whoever came, there was a corona test. There was one officer. In fact, we have a control room now in the SSDMA. The whole SSDMA is converted into corona control room. And there is one very senior and experienced officer. You know him, Mr. Rinjing Chuang, who was with the SSDMA earlier as additional secretary. Now he's secretary agriculture. So he's in charge of corona. And he is monitoring each and every person coming from different states. After medical examination, when we find that there is, a corona positive person, then we bring the person, to Gangtok. And there is a specialized hospital in Gangtok now for corona. We have all facilities. I mean, as you rightly said, that till date, there are not many cases, so there is no any shortage of PPE or anything. There is no medicine known, so we are also doing the same thing, which is coming from All India Institute of Medical Sciences, or some experienced doctors are saying. But the good news is that there is no serious case out of 7. And we hope that within few days, again, Sikkim will become, corona free. But at the same time, there are still about 3,000-4,000 people who are, we are planning to bring them back. And in Sikkim, it is altogether different, in fact. We are requesting other government. There are some people in West Bengal, and our officer were in touch with the West Bengal government and asking them that we are sending all, vehicle and everything, you kindly send them back. And they were not having any database or anything about them. So we are telling them that this is the name of the person, he is living in such and such place, and you kindly arrange. So we are getting another type of problems in Sikkim, and not getting that type of cooperation from other states, which is really required in this kind of situation. But thank God that the number is not that much. As I told you, it is only 10,000 plus, and more than half already came. So we are sure that out of these 2,000-3,000 which are coming, maybe there will be few more cases, but we will be able to tackle, because we have a dedicated hospital, dedicated doctors, nurses, etc., and medical facilities. There is one more point, Vikrant, which I would like to mention here, and then I will stop. That Sikkim is one state where you get very good cooperation from people. It is altogether different than other states. And panchayats are very strong. So our positive point is that we create awareness, in panchayats, and we told them that these are the do's and don'ts. We told them that, in case there is any, this thing, SSDMA and the state government will help you. And they listen to us. And the result is that today, whatever you are seeing, that earlier, 1 week ago, this was corona-free state. And this is because of people's cooperation. If we are saying them that you should not go out of the state, then nobody is going. If there is a very serious case about medical or any emergency, then only they are leaving the state. Otherwise, so the complete lockdown, and they are following, all guidelines, instructions, state instructions. Our chief secretary is so sensitive, and he, right from the 5th of March, each and every office, each and every common place, there is a system of sanitization. There is a system that, and he created lots of, public awareness, told them, do's and don'ts. And I think I'm very happy the way state handled this disaster. I stop here, and then I will discuss, because there are some very knowledgeable people in the panel, Shekhar, Manish, and in case there is any other issue, I will certainly like to contribute. Thank you.
Sure. Thank you so much, sir. I think it's really helpful. I think it's a very typical geography of the state. Maybe the access and entry points were easily controlled, and a good leadership. And I think you said about the preparedness. Perhaps the state has the data, the plans and the data which was ready. And there, I think a lot of and the leadership and the awareness with the people. Which has been happening, and also very cooperating people also. I think a lot of these had remained the factors which we hear in Sikkim, and I think Dr. Shekhar is still stuck up. Though Kerala is another states like Sikkim, where we have having a close cooperation with the SDMA and working there. And in fact, when the initial first few cases in January, 30th January, I think was coming up, and that's the time we happened to myself happened to be with the SDMA there, and again, I think from what I could see, sir, Kerala, the way the entire crisis has been managed over there, right from identifying the cases, the contact tracing, again the awareness, the leadership which came up into there, uh, the the strong community structure that we see in Kerala, and the workforces on the ground, like Kudumshri and intelligence groups in the various districts, and all of them working together. We seen another extreme of a global case study, which has been able to flatten a curve to a significant level, while most other places with a similar population and population density, it has been rapidly increasing. I wish Dr. Shekhar would have been there to give us an inside story and an inside learning over there, but maybe he'll join in sometime. In the meantime, I think I go back to Manish again, looking at the situation in Delhi. Manish, now since we got some learning available from various contexts and also from our own experiences, and we're moving from a lockdown to unlockdown, right? So I think the challenge begins now, and also I think the rate of doubling figures in India is now perhaps second, next only to Brazil. I think we are doubling the cases in 14.5 days, and in Brazil is in 13 days. So, and in this context, when we are opening up with a lockdown, uh, how prepared we are as Delhi, as a city, to deal with this situation, and what are some of the guidelines available? How's government of Delhi geared up to take care of this challenge now? Over to you, Manish.
Right. Thank you, Vikrant. No, actually, it's a very important to understand that we can unlock any city or any country for certain period of time only. Like, it's absolutely not feasible and impractical that we can lock down a country forever. So, like in phase one of lockdown, phase two, phase three, phase four, I was listening in one of the radios that at least it helped the society to get mentally prepared how to live with corona and how we can be more disciplined. So that is one. And second thing is, honorable chief minister has been keeping people of Delhi updated through regular press conference, and where he always say that the time has come where we need to also learn how to live with corona. That we need not to be afraid of it, but rather we should be very very careful that how to handle this virus. So lot of awareness is already going through with media, TV channels, conferences with a lot of civil society organizations, and I think mostly people are also aware. Secondly, a lot of agencies are already in place which are executing, like our all DM offices, SDM offices, all helplines, Delhi police, different stakeholders. Everybody is alert, health workers. So that way, I think the whole city is very serious. And as Professor Vinod sir already mentioned, that people of Sikkim are very nice and very cooperative. I think I should say, sir, Delhi people are also giving good competition to people of Sikkim. For a change, they are also cooperative, and actually, in a manner like this year, last year we had a campaign on dengue, like 10 weeks, 10 weeks, 10 minutes, and it was on like one more 10, and people actually participated. Every week they used to clean that standard water and all. So that is how people also appreciating this fact that their participation is ensured and sought by government in a more humane manner. So this thing can't only be achieved if only government is active. It's this we can only go on unlock one if people are more prepared than just the government. So I think that we have already started, and things are happening in a gradual manner. Like, we are not opening things which are not mandatory. For example, we can still delay some schools, we are still delay some colleges and all. Like lot of classes, like even my kid classes going on Zoom and all, which I'm not liking very much. But these are the alternate options where things can wait. Those things which actually can't wait, like essentials, food, medical, there, in a gradual manner, it's opening. People are more disciplined. Like you can see people wearing masks. Uh, Police is more disciplined in terms of like they are actually identifying people who are, you know, not following the rules. There are challans happening. A lot of awareness is happening. Like I think in 92.7 or radio FM or there's always discussion on corona. There is no other discussion which is actually happening. If you could track the trend, there's only corona talks on radio than the TVs now. There's no talk. So that way I will say the society is more ready and prepared, and we must look forward for unlock down one. But yes, we need to be very, very careful. We need to go in a very phase wise manner. Uh, we need, like, it's a challenge, but we must accept that the time has come where we have to learn and live with corona.
Yeah, agreed, Manish. I think I just hearing you, we see that effort. I think the level of awareness, I think, is has gone very extremely high in the people and the cooperation coming from all around. But the numbers are also rising along with
Yeah,
that.
yeah,
Uh, we have got enough time to prepare ourselves. I think if we compare ourselves with the Mumbai, for instance, Delhi in a comparison to Mumbai, so there are already rumors around that Mumbai is out of the number of beds required over there, hospital beds I'm talking about, and other facilities. So, are we forced any kind of anticipatory planning happening in Delhi? What is it that Delhi needs?
yeah.
And and something similarly anticipatory planning with other services also. So can you share about that also?
Yes, I think very important question you asked, Vikrant. Actually, as I said, s- like this is going to happen through multi-stakeholder engagement. It's only not only going to be the government's role. So, as I said, few of our hospitals we actually converted into COVID hospitals. So, more around 7,000, 8,000 beds we have, and many of our beds are still vacant. Now the graph is actually going up. We are also gearing up. Recently, I think last week we are also having a meeting with all private hospitals and small nursing homes. We try to brought them on our panel, where we say any hospital or small private nursing home which has the capacity above 50 beds should tie up with government of Delhi, and they should dedicate 25% of their beds only for COVID. So that facility we will be able to help that how 25% of the portion of the whole hospital can be converted into COVID one. But I think yesterday press conference or day before yesterday, you must have heard that things are not going very easy with private hospitals. There was a rumor that the term was used as like private hospital mafias, where they have started making packages of corona, like 3 days of corona is this much of lakh, 5 days of corona treatment. So that is some like the way we used to fight with the private schools 5 years back. Now we are fighting with private hospitals, that not commodify, not make it a business venture. Not Please don't consider this corona as an opportunity. In fact, it's something, it's a social cause. We really need to be at the same level. So here government of Delhi is finding a bit challenge, but we have actually wholeheartedly invited all our private stakeholders and players, where they should come forward and join heads with Delhi government, where we provide all the legal and whatever possible support we can do, yeah, and they provide their premise, so that today we have 7,000 beds, tomorrow immediately we can have 14,000 beds and the 20,000 beds. And I said in my previous deliberation that if you are fit and fine, every person infected by COVID doesn't need a bed actually. Like it's like same in dengue actually. Anybody got the dengue doesn't need to be admitted every time. It's the 5 to 7% of critical cases, and death rate in Delhi is the least in country actually. That's a fact. Our testing is like I had a data 12,000 per million, which is again the highest and the second highest in the country. So that way we are very well prepared as compared to the other parts of the country. The only need we need a solid coordination, which is your role also, of where all stakeholders can actually come together and just forget all differences or the mottos for some time and just join hands. That's why we recently, I think yesterday, government of Delhi was a little harsh on one of the hospital where we did one FIR, and we were a little harsh on some 8 private labs where they were just charging too much or some delaying the testing. So these were the tactics which private players are playing, which we are not very happy with. Once these things are sorted out, I'm sure number of beds is definitely not going to be an issue in Delhi. We are very well prepared for that.
Yeah, Manish, thanks for sharing that. I think it's quite assuring about knowing that at least the discussions and talks are on with the private sector and private sector engagement. Otherwise, I think this remains one of the area where not enough information is coming around. And yes, I think the lockdown has perhaps helped in, if nothing, in terms of delaying the surge in the number of cases and giving enough time to the system to prepare up and gear up to the needs, which perhaps is as the COVID is a new normal, a new reality. We have to live with it, and it's going to be there. Maybe I'll go with Professor Sharma also. Sir, you said I think one of the big factors, perhaps in the case of Sikkim, has been that its geography also. I think the access to Sikkim could be controlled and easily, and the population movement in the lockdown could be. But do you think now with this unlocked down and the free movement between the states happening, uh, and also as you're saying, the migrants workers, even though the small numbers which are there from the Sikkim coming back, so do you see or anticipate that it could create another wave in terms of the rise in cases there, and how prepared is Sikkim as a state now? Look with a you know when we see, we also do that in terms of, I think, living with the new normal. I think one of the hypotheses is also this, that we have to find a way of living with COVID for a long time. So we're into a long overhaul now, and perhaps it will stop, at least in the case of the country like India, only when we have got a herd immunity where at least maybe 60 to 70% of the population got exposed to it. So, is there any kind of anticipatory planning happening with all these hypotheses and thinking into place for Sikkim? And maybe, sir, you can share, because again, your experience is not limited to Sikkim. Somebody most senior person in disaster management. You can also share a bit of advice for the other states also, including Delhi. Over to you, sir.
Thank you, Vikrant, and you ask very good question. In fact, Sikkim, we are now developing a strategy, for, in fact, before the unlock, we were thinking that what will happen when there will be unlock and people will start coming as tourists or something, because main income of the state is tourism. But then we are, doing analysis. It's what is our priority, health or money? So we ask people, and as I told you that in Sikkim, the best thing I find that the whole thing is participatory. The hotels and the tourism industry, there is a constant, meetings with them, and trying to find out, what people want. Do they want that the people come from all over the country, and then the situation become, unmanageable, because we have limited hospitals, we have limited facilities, and in that situation, I think we will not be able to control it. So I think the state is, I should say, very, very sensitive on those issues, and their priorities are very clear. As you might have seen that when the state become organic, I think, it was a fully educative process. For 20 years, the people were taught that, do you want good health or more money? So I think that kind of approach, and once you convince people that you wait for some more time, and definitely, we are also affected. Economy is affected because no tourist is coming to the state. Nobody is allowed. But people are happy. They are saying that, yes, we can wait for some more time. we cannot compromise it on a health issue. I would like to mention one thing which Manish was mentioning, and I think Manish is very experienced person, very knowledgeable. I think in case you see the Disaster Management Act 2005, in chapter 10, there are, penalties on this kind of thing. In case people are doing this kind of mischief and not following the state guidelines or central guidelines, there are huge penalties. All these hospitals, and I think there should be a tough decision at political level. And in case you want that you people should be served now, and these private hospitals and labs, they should not make money, there is enough provision, in the act. So I think, I appreciate, central government, which is using this act, and read each and every section of it. So I think each and every state, not only Delhi, I'm saying the same thing for Mumbai, where for one, ambulance, you have to pay, just for 300-meter or 200-meter, you will have to pay 8,000 rupees. So I think they should be very strict in this kind of situation. Otherwise, there is no use of the act. And so this is one. My last point is that I fully agree with Manish that this is one disaster. In fact, every disaster. In every disaster, unless and until you convince people, and people they know that the government is with us, then only you can manage it. And this is the mantra which we have used in Sikkim. In fact, people of Sikkim, they have full confidence that whatever is government is saying, it is correct, and we should follow that. I think this confidence should come in people, and otherwise, without their cooperation, without convincing the whole population, because Delhi, Maharashtra, Kerala, they have very high population density, and mitigation or prevention of this kind of epidemic, that will be a big thing unless and until people are with us. In this situation, I agree that someday, you will have to open up. But at the same time, people should know that what is our role, what is our responsibilities. And today I was also there in Delhi, and I find that most of the people, they are following social distancing, but most of them, they don't care, what is happening. They are having a mask, but the mask is there on chin, not on their face or something. So I think that kind of carelessness, which is normally there in our people, that should be taken care. And somehow, there should be a psychological or, we will have to convince them that doing all these things, because living in house is not the solution, someday you will have to come out. So I think by education and by this kind of means, we can overcome this. Otherwise, the issue is very big. We are not even anticipating, how big is the issue. And I think in case we are not very serious about it, still I'm saying that the population is not serious about it. I'm sorry to say, because they feel that nothing will happen to me. This is for somebody else. So I think that approach and chalta hai approach, this is our weakness. And the seriousness of the problem should be realized, and people should come and join hand with government, help them, because they have limited manpower. They have limited, I think, assist the police and all the workers, who are working for us. So this is my request, that there should be some approach, and in some cases we should have political will, that we will not allow, these business people to make money in this kind of situation. And I was in IIPA and people were giving examples that in this such and such hospital, this is the rate of the bed. This is the rate of the bed for 4 hours, this is the rate of the bed for 1 day. So I think that kind of thing is very harassing, and it is very unfortunate, I should say, in the capital of this big country. Thank you.
Right, sir. Thank you so much. May I go back to Manish again? Manish, it's not just the migrant workers now. I think Delhi has been hosting a large number of them. They're going back, but a large population in Delhi itself has been employed in informal sector, and or they were daily wagers, and they were big vulnerable group population here itself. So for them, which is maybe not going back, the lockdown has greatly impacted their livelihood and their reserves, and we don't foresee that the unlockdown is going to immediately create situation in which they able to recover from it. So how is the government of Delhi planning, with social protection schemes or other such initiatives, to take care of these people, that they are able to meet their lives and address their lives and livelihoods needs during this time? Over to you, Manish.
Very important and in fact very necessary question, Vikrant, which you have asked, because this migrant population is the most important part of our lives actually, and these are the city makers actually. One of our Hindu says them city makers. If they are there, then city runs. If they are not there, city doesn't run. So like I didn't share in the beginning actually, the immediate thing which we did with the informal sectors, like for example construction workers. In the first tranche, whoever or whatever number of construction workers which were registered with our labor ministry, we immediately initiated the cash transfer mechanisms. You remember whenever disaster happened, like Feline cyclone or tsunami or whatever, cash transfer we used to consider as one of the immediate measure to the beneficiary. So that we immediately brought into action. So first target group, we took the construction workers, those who were registered and their details are with us. We immediately transferred the 5,000 cash, and that still continues for the second month, and it may continue for the third month as well. Second, those who are the pension holders, for example, like widow, and her son may be a rickshaw puller or her son may be a vegetable vendor. So at least we have 25 lakh families whose we have a data. So we immediately doubled their pension. Like whoever receiving 2,500 during this corona period, we are giving them 5,000 pension. So construction workers is one section, then widow, person with disability, and old age. So maybe the pension is going to a widow, but the money is going into the family. Hmm. Third, those who are linked with our transport department, like for example, auto drivers or e-rickshaw walas. We created a small Google form, and you just fill that form and give us the details. And whoever is in, like, the e-rickshaw walas are partially informal sector only. We again did the second cash transfer to these transport people. Fourth, those construction workers who are not registered, for example, but still are in this field, or for example, e-rickshaw walas who are not registered, but they are having legal papers and all. So we have opened that link. So even if you are not in the government system, but if you provide those basic minimum documents, we are immediately bringing them in our social welfare schemes, especially in this corona period. So that is the immediate cash transfer thing which we are doing it, especially those people who are living in Delhi and continue to live. We are making all efforts to track them in and to bring them on our formal systems. Second is the population which feels that they don't want and they really want to go back to their native places. And I think in the media, we all must have seen, it was a huge crisis. And in Delhi, there are quite a few people from Bihar and all. So we requested with this railway ministry, and I think more than 200 trains actually started from Delhi, which moved to Eastern UP, Bihar, Chhattisgarh, West Bengal, Jharkhand. These are the states. With the help of civil society organizations, like, and I think you were one of them who actually helped in this Delhi government initiative, where we organized, I think, more than 100 buses, which took these migrant workers from Delhi to the neighboring states. Delhi, oh, many people say why Delhi government is not arranging. Like Delhi government's own transport fleet is not equipped for interstate travel. Like they are all CNG buses. They can't go to Bihar. They can't go to other states. Second thing is, if you do the transfer of migrants at so large scale, we can't rely every time on the private vendors. Like for example, if you need to bring migrants from Dubai or Indian people from Dubai, Air India will go. It's not the Jet Airways will go, because it's the government responsibility to bring them in. So if our migrants will go from one place to another, it's the state is responsible. So there are a lot of challenges that we just can't hire XYZ transporters and they just go. But we are taking the help of civil society organizations. Our administration is providing permissions. Our corona testing centers are doing the screening so that they get the hassle free movement from one state to another state. So those who are living in Delhi, we are trying to bring them in our formal system so that they can be the part of either ration facility or the cash facility. Second, those who really want to go back, we are in touch with central government through railways as well as civil society organizations, and 1 hour dedicated MP and 1 hour dedicated MLA, couple of them are responsible for sending back these migrant people back to their native places where either they feel secure in Delhi or back to their places.
Great. Thank you, Manish. Maybe my same question for Professor Sharma also. So, sir, within Sikkim also, maybe the lockdown, as you say, the economy is largely dependent on tourism, and there has not been tourism in the lockdown. And among the population, there are vulnerable groups, the people who need social protection support, and among them, maybe the vulnerables also is the people with disabilities, as some of the participants are asking about these people also. So is there anything special through social protection schemes the government of Sikkim is addressing these needs? Can you please elaborate on that?
Yes, I will say 2-3 things. One is that we are fortunate that the number of such people is much less in Sikkim than Delhi. Delhi is a very high proportion, people of this kind. But we have people, and there was a provision. Whatever, for example, central government announced that we will be giving or assisting farmers. Similarly, we also assisted farmers. We assisted, the widows. We assisted, disabled, and all this state help that was given to these people. But as I told you that in all the districts, this number is not very high. So this is a plus point. Second thing is, we don't have very strong civil society network in the state. And mostly people, they believe in government, because otherwise, civil society used to have this, they used to help, assist these people. But here, because the government is having all database and they know that where the help is required, so that was provided. And still, as I told you, that we have a control room. And in case there is any requirement, we have given 2-3 numbers. The whole SSDMA, in case today you go to Gangtok, in our secretariat, there are about 10 people sitting, 24/7. And any assistance required, we used to provide help. So I think this doubling pension and all these things, because we have limited resources, we can't do that. But at the same time, the assistance which is coming from central government for the farmers or for, this kind of categories, So that was given to the people basically. So that is important. If the funds which is coming from central government, that all Northeast states, we don't have that much of income. Our resources are very limited and depend on central funds basically. So in case this money which is coming from central government, in case it is utilized properly, that is a big thing. And that was ensured that any assistance coming to farmers, coming to workers, coming to unemployed people, and that is there. Earlier, when all these things started, Manrega program and all these things, that was there. But I think there is, I don't have any report that in any district of the state, there is few people, which are without food or without any, So I think this is the situation which is good. And this is because of less population and good governance. One more point I will say, you are, great advocate of Sindai framework, and Sikkim government, you see our state plan, you see our district plan, we have, and we were the one that when it was signed in Sindai in Japan, immediately after 2015, we hold a workshop in the state, and the Honorable Chief Minister that time, he announced that whatever is the commitment of central government, state government will do accordingly. So as far as the Sindai framework is concerned, the second point, which is saying risk governance, I think, and mainstreaming, which we are talking a lot, I think we have done it in Sikkim. And this is one thing, one very important thing for reducing risk, any kind of risk, it may be for any disaster. And recently we did a research program in Sikkim, that in case there is complex disasters, and I think this is the most complex disaster which has happened. So I think we used to do this kind of exercise, and we should be prepared. I will say that a state like Kerala, which faced a very big disaster just a year back, and the governance in Kerala is I think I have all appreciation. So similarly for all states, I think governance has a very important say in risk reduction, and that plus point I am seeing in Sikkim. And I think each and every officer, each and every department, they are sensitive to it, and this is important. I have not seen any case in any hospital. There are mostly private hospitals. We have very one or two, government hospital in Gangtok. Rest are all private, but not a single case where there is this kind of extortion, which is there in Mumbai, in Delhi, in Chennai, and big metropolitan cities. I think this should be stopped. Thank you.
Yes. Certainly, sir. I think you also mentioned about the complex disaster. I think the complexity is certainly building up now. Perhaps I think we are already seeing the onset of monsoons in Kerala, and in Delhi also. I think it's the monsoons, and monsoon onset brings its own additional dimensions to the whole. But we are also observing a lot of seismic activity in Delhi. I think last few weeks, the number of some low intensity earthquakes which we have felt. So this is all adding to the complexity. And Delhi, we all also know that not just a few a month before COVID, also have seen some tensions in the northeastern district of Delhi between the communities. That's the complexity which we are. So Munish, in this situation, forcing towards monsoon, and even some other participants are asked about it, it's require a more multi-sectoral approach. I think we tried to do that during the response to the Northeast Delhi conflict situation also. but how are the various sectors and essential services needs within the government coordinating among each other and with the other stakeholders to look at a multi-sector, multi-collaborative response? Not only to the COVID now, but my question would, I would say, because time is running out, I'll put more forward towards a preparedness for a monsoon or an earthquake kind of a situation ahead. And okay, yeah, I mean, I keep it to these two things only. Over to you, Munish.
Yeah, Vikrant, first pray that Delhi get a better monsoon because hardly we get a rain. So, but I think thanks to, not thanks, I will say this, because of this corona and northeast violence, over the state disaster management authorities and district disaster management authorities are much more prepared and geared up. And the discussion is already going on in the within department. I think in 7 days time, you should also get a call from us for this basic preparation. And I think in Delhi, we are more worried about the earthquake thing because we are facing a lot of tremors in last 1 month and so. About the flooding situation, I think we have very less part, which is the Yamuna Khadar area, which is more vulnerable. But I think our east, northeast, and south districts are well prepared. But the only thing is which and DUSIP, Delhi Urban Shelter Improvement Board, is ready with all shelter preparedness. The only thing is which we really need to do with civil society organization, how in this monsoon situation, if we need to evacuate these people from the Yamuna bed, how still we can maintain the social distancing all considering the COVID situation. Uh, that is one where we are going to call Sphere for sure and other partners for a multi-stakeholder engagement for the better preparedness of this monsoon situation. But yes, I think apart from monsoon, earthquake is another one we should have discussion because today also there were some tremors, and for that no discussion has started yet. So I will also request you to please create some pressure on us. That's an official invitation. So because there should be some dialogue, because if during this corona, God forbid, it should not happen, but if earthquake happens, then I think it will be a multi-hazardous situation for which I think city or the government may not be prepared as of now. So I think in a week or so we should start having that dialogue with you and other players as well as different departments and different nodal agencies within the government. I think that is the need of an hour. That's not a matter of choice anymore. We should do it quickly.
Yeah, thank you, Manish. Maybe something similar, Professor Sharma. How is Sikkim? I think my experience has been there with the Sikkim earthquake. That's when I spent a lot of time there. But now maybe the floods, and I think we have seen a couple of incidents of that also, and overall disaster preparedness. And also,
Vikrant, yeah,
yes, sir.
yes, carry on.
And I just add to it, so one of the participants specifically want to ask you a question regarding, how the state has been able to sustain its maternal and newborn health services in this the COVID context. They basically want to understand how the COVID has impacted the pandemic has impacted on the essential health services in Sikkim. Maybe I think.
No, in fact, as I told you that we have one separate hospital, for this pandemic, for corona. And this is COVID hospital, in Gangtok. So other hospitals are not affected and the services are going on as it is, So absolutely no difference. It is as usual, so only one government hospital is converted into a COVID hospital, and rest of the hospitals are working, functioning normally as they were doing. So this is one. Second thing is that you have asked that now the monsoon is there. Not only monsoon, there are some other factors, and we are preparing ourselves for that. You might be knowing that, you know it, that Sikkim is having more than 300 glacial lakes. And these glacial lakes, they are all, increasing in size. And there are about 10 glacial lakes, they have increased 8 to 10 times, in volume. So this is our concern. There was one lake which is called as South Lonak Lake. It increased about 10 times, than the normal volume. So what we did 2 years back, with the help of science and technology, with the help of Sonam Wangchu and some experts, we punctured that lake and removed that water in Tista so that, we can avoid disaster. So we are very careful. The great part is that science and technology department, we have full database. We have all scientific knowledge that which lake is increasing, how much it is increasing. So it is not only rainfall, which is alarming. The most critical thing for Sikkim is the GLOF, the glacier lake outburst flow. In case it happens, then it will affect the population, village as well as urban areas. So we are working on that actually for GLOF. The second important thing which is happening in Sikkim, that is forest fire. And forest fire frequency has increased many times. Last year in 2019, there was enormous loss to the forestry because of forest fire. So these are the two disasters. We have flash floods, so there is no much problem. We are having full preparedness for that. We have a system which is working. So flash flood is not a problem for us. Riverine flood, there is no much problem. But the major problem is landslide, which is usual. And every year it is increasing. You might be knowing that if you go to Gangtok in monsoon season, you don't know when you will come back, because every day there is a roadblock and landslides. So that is one disaster. But other disasters are equally important. And as I told you that with the climate change, when there is less moisture in the atmosphere, the forest fire is very common these days. And we are worried for that. We are worried for GLOF. We are worried for, the pandemic, this kind of epidemics. So I think this kind of complex disasters, we should have some planning for that. And we should prepare people that in case there is, this kind of situation, then what should be done? I like Manish's statement that earthquake, and in 1 month, 2 months time, there are 13 times, there is earthquake in Delhi. People are saying that they are precursors and there may be a earthquake. So, I mean, we should not create panic, but at the same time, there is no harm in creating public awareness. And this awareness, do's and don'ts at different level, I think this is important. And we should get prepared, for medical and this kind of assistance, which is required. So that preparedness is altogether different. And India is having sufficient experience, about earthquake. So I think Delhi should take lessons from Maharashtra, Latur earthquake. They should take lesson from Gujarat. They should take lesson from Uttarkashi and others. So I think from Sikkim, I think so that type of thing. God forbid, we don't wish that this kind of disaster should happen now, because Delhi is in very bad state today. And this COVID-19, it's a big, threat to the state and to the state people. So we don't wish that any other thing happen to Delhi. And even the flash flood, we don't want that. But I think they should be prepared for that. I mean, the drains and all these things, because every year, we have flash floods in Delhi and hardly any, we have preparedness, but that preparedness is not sufficient for the capital. I think capital should not suffer because of flash floods and all these things. So I think some more measures can be taken, and some structural, non-structural measures are required. And I think, I'm sure, because now some learned people like Manish, they are with Delhi government. they will certainly help them and make a foolproof plan. In fact, the plan which we are having today in Delhi, I mean, I think it needs immediate revision.
Yes.
Thank you.
I completely agree with you, sir. I think thanks for bringing this dimension. I think my question to Manish was also from this perspective. The Manish felt it's few districts in Delhi which is where floods and evacuations are required, but I think I wanted to hear more from the urban flooding. You know, the how we're preparing the cleaning of drains. We see the city get a couple of rain spells and we roads get choked, and there's long people have to negotiate the long times over roads to just reach out. I think last few years it's happening. And also, I think time is running out, but I would like to maybe put some pointers toward this, that we wanted to hear more from the vulnerable groups question, also more from the point of view that, how we're looking at beyond the migrant workers, but within them, the complex vulnerabilities to women, maybe pregnant women, children with disabilities, how the multi-sectoral response and multi-sectoral coordination is going to be addressing them. But maybe it's time to take two questions directly from participants. I have taken few questions from the chat box and put to the panelists, but maybe a few hands also up. You can take up the question, and if you think you have opportunity to intervene these issues also in your answer, please do that. So we see Mr. Anil Kumar. He's raised his hand. Um, can you unmute yourself, Mr. Kumar, and you can ask your question. You have to unmute yourself.
Vikrant, I've sent him the unmute request. It seems that Mr. Anil is not accepting that request. I'm sorry for the thunderstorm behind me. Mr. Anil, can you hear us?
Okay, so maybe in the meantime, if anybody else want to ask a direct question to our panelists, please show up your hands. Okay, so maybe I'll take with the pointer I've given earlier. I can take another question from the panelists in the chat.
Vikrant, we have a raised hand from Mr. Javed Tak. May I just go ahead and unmute him?
Yes, please, Valerie, if you can.
Mr. Javed, I've sent you a request to unmute your. Oh, sorry. Can you one second. Mr. Javed, are you able to? Yeah,
Hello?
he's here.
I'm Javed from Jammu Kashmir, and I just want to know about the uneven rains and hailstorm in Jammu and Kashmir from last 1 week. For full daytime, it is sunny, and for at the evening, it is windy. And even today, the most of the places, so many roofs have been shut because of the heavy winds. It was not earlier in June. It was very good kind of atmosphere. Second question is that person with disabilities, what should be the now post-lockdown factors that person with disability should follow to ensure that they will remain safe?
Thank you, Mr. Javed. Over to the faculties.
Yes, among the panelists, anybody would like to address the question?
Vinod sir?
Javed, your question about Jammu and Kashmir, I will answer this way that Delhi, last month it was May, and people have not seen, this kind of pleasant May. The earlier part, only 2 or 3 days, the temperature was 44 degree. Otherwise, the whole May was so pleasant that people say that we have not seen in our lifetime this kind of May. And same thing is about June, that you see that, so all these changes we are seeing everywhere. It is not only Jammu and Kashmir, everywhere, this is, so the climate change and its impact, it is obvious. And all this kind of variation which we are seeing today, this is because of climate change. So now there is no doubt in it, that things are changing. And so everywhere, I was in Sikkim, and I observed the same thing. I was there in March, and every day, it was raining so heavily that March was so wet that it was unprecedented. So these things are happening everywhere. I think I will ask Manish to answer second question.
Thank you, sir. Uh, uh, yeah, actually, now this person with disability in this time of crisis, it has two dimensions. A, it's true that that everybody is at the same risk, but people, those who are more vulnerable, are definitely at more risk. So they really need to take care of yourself, and their families also need to be taken care of them as well, because once they get infected in certain disabilities, they also need the support of others. And and here at times we see, because this is a type of infection, that many a times doctors are also taking precautions. Like, it's not a normal situation where doctors are visiting you after every hour or the sisters are visiting you after every half an hour. So one vulnerable group need to take extra care of it. That is one, dimension one. But I will say second dimension, which is more empowering. Like, I was monitoring one of my ration center and hunger relief center, where we have uh, I have a differently abled volunteer who is on tri-rickshaw, and is our star volunteer. Like, he come at 7 a.m. in the morning on his tri-rickshaw. He can't walk, but he's star. Matlab, he is a pain to all our government officials. He keep all our civil defense staff in line and queue. He maintains the, he ensured that people are ensuring the safe distance. He ensured the quality of ration. He ensured the quality of food. He ensured the quantity also, that each quantity is given to all ration card holders. And that is the person belongs to we call that like person with disability. He's a star. He's a champion. So when I have a person like who is actually a corona warrior in front of me, matlab, he is better than anybody else. So I say there are two dimensions. We just need not to, like, definitely we should, like, precaution needs to be taken by everybody, but also it's a inclusive intervention. Like, we also should not make them overtly vulnerable. Wherever they can participate, they should participate. They are equally capable, sensible. They can take care of themselves, and they should feel equally empowered. And and they can play the role. So I will say there are two dimensions of it. I mentioned both of them.
Yeah, thank you, Manish, and thank you, Professor Sharma. And I think, Javed, maybe to the first part of the question, if I may just share a bit more, is I think, right, Professor Sharma has rightly said that, it's the weather which is changing now. We are not finding usual patterns, or if we analyze data of last few years. But this one is, I think, is coming up from the Western disturbance phenomenon, which is generally observed in the month of February and March. But we have started seeing that the waves of the western disturbances coming, which affects primarily the northwest of India, and that's where the Kashmir also is. Jammu and Kashmir that's getting impacted by it is there. So we have started seeing a trend that these started seeing being even late in the month of May and June, and that's probably attributed to changes in the climate and weather. Our whole debate about climate change could be linked with it. Not very sure, but I think there's definitely a component of western disturbance impacting these rains. So for us is to stay informed about the local weather conditions, and with the weather updates available to us, and work around these. And yes, these kind of issues definitely making our, in the COVID context, making it more complex and more thing. But today's session was a lot of learning. I think a lot of more deeper insights into what's happening at the various levels, and maybe coming towards the end of it, before I hand it back to my colleague, just a quick, very briefly, if I would like to ask Manish and Professor Sharma, as civil society and other collaborators, what's your one or two top expectations from our side, how we can support, the government and the authorities, to deliver on this collective responsibility. Over to you, Manish and Professor Sharma.
May I say, sir?
Yes, sir, please.
No, actually, at this point of time, I think the role of agencies like Sphere become more crucial. See, because a lot of things are going in government actually, and many times, this time everybody is overwhelmed. So your role becomes very, very crucial. I say, I request you, invite you actually, to be a advisor, to be a pressure group, to be our conscience keeper, and please be on board. You are wholeheartedly invited. You have seen we working together in Northeast Violence. So this is the time again. Please don't wait for another official invite. Please, we will connect you to our revenue minister who heads the disaster management. We will facilitate a meeting. Please come up with a plan to us. There may be very less chance for brainstorming. We request you, just come with a draft plan where we see what government needs to do, just one pointer, and what are the gaps and the challenges, and what exactly current situation is. If on these three lines you come up with a plan and propose it to the government, and things will click. Our CM, deputy CM, revenue minister, all are very open for any suggestion from the civil society. So we are waiting for you.
Thanks, Manish. Thanks. I think let's see how we put it together and come up to your expectations. Yeah, right, sir. Professor Sharma, sir, you are mute, sir.
Yes, I fully agree with Manish Kaushik that I think this is the time when civil society and government should work together. And most of the states, Delhi is different. Manish is saying, so I believe him, that they are listening to civil society and caring for them. But most of the states, they want to work. There is always competition between the two. But in this kind of situation, in fact, in any natural disaster, civil society have great role. They are with these communities, they know their problems, they know their issues. And I will say that all the time, not only in COVID-19, not only in this situation, not only in one or two disaster, I think all the time, in preparedness, in mitigation, in response time, in recovery, I think each and every step we need civil society. And in case we are ignoring them, then it is a mistake. And someday you will realize it that we are ignoring a very important group, which is near to the community, which knows that what are the issues of the community, how they can be, more participative. This can be through civil societies. So I see much important role. And I will say that not only NGOs or civil society can work alone, not only government can handle this kind of situation. I think all three stakeholders, government, non-government, community, and even the academia, I think they should work together in this kind of situation. And in fact, community or the vulnerable groups or the, people need your support, at this time. We should not have any politics. We should not have any grudge, from anybody. I think this is the time when government, non-government, academia, technology, scientists, they all should work together and face this kind of disaster. Thank you.
Sure, sir. Thank you so much. We assure you our best support. I think, let's see, we get ready for the future preparedness. I think it's my moment to thank you, all of you. I think my thanks to all the participants who have been very patiently listening to everything, and for more importantly, for all the good work they've been doing on the front line of this COVID war. My thanks to Manish. Thanks to Professor Sharma. We missed Dr. Shekhar from the Kerala, but I think Monsoon is already there and he's very busy person. There's this. We'll get to hear from him soon. My thanks to everybody. Thanks, Valerie, for organizing. And this is my moment to hand it back to you. Over to you, Valerie.
Thank you, Vikrant. Thank you once again to all the panelists for being here today. I'm going to just share my screen to make some administrative announcements. I hope my screen is visible now. To receive your certificate of participation for this panel discussion, please visit the following link after 24 hours, which is www.sphereindiacovid19academy.org. You will see a certificate button next to the name of the panel discussion. Click there, enter your registered email IDs, and download your certificate of participation, please. For the next session, we are having a panel discussion tomorrow. It's a very, very relevant discussion as we approach the monsoon season. So we're having a discussion on flood in context of COVID-19. And we have panelists from different stakeholders come and discuss strategies about this. So they're scheduled tomorrow from 4:30 p.m. to 6 p.m., which is June 9th, 2020. You will find the registration link on our website as well, and we will email it to you shortly as well. For any more queries, please feel free to email us at covid19academy@sphereindia.org.in. That would be all from my side. Thanks everyone for joining us today. Thanks Professor Sharma. Thanks Mr. Munish, and thanks Vikrant. Everybody have a safe evening and take care.